It's really a pleasure to be here. Can you guys hear me at the back? Loud and clear? Okay, awesome. Again, it's really a pleasure. I'll give a quick background. Myself, I'm a physician and I'm an engineer. I do code more than 15 years. I do practice as a doctor more than 15 years. I have patents. This is just to give the context so that you guys understand. So I run two companies. HeHealth is a sexual health company which we are innovating with AI, which is San Francisco based. And also we just moved to a bigger company called Agi, which we provide the full scope of AI services. Okay, these are my disclosures. Obviously, I wear many hats, physician, engineer, and a CEO also. And all this starts 2019. One of my friends messaged me, a good friend who's a guy, saying, thanks for being a good friend. And guys don't message like that. I'm sure girls do that, but guys don't. And as a physician, I have seen these kind of messages, but sadly, they are all in suicidal notes. I was so scared for my friend. I rushed to his house and we were so right. He was in the balcony of the 8th floor about to jump and managed to grab him, bring him to the home and ask what's going on. Long story short, he said, I have HIV. I was his physician, so I know his medical records. Of course, there was a gap of like few months. He could have get it, but I asked, how do you know that you have HIV? Do you have a blood test? He said, no. I Google and I have all the symptoms. Believe me, this is actual case. And I have seen many patients come to my ER saying that I have a cancer. I ask how, and Google says so. And this guy was so convinced, and he would rather jump out of balcony and kill himself, or when the wife knows that he had slept with someone else, then wife kills him. So he chose the first one. But as an innovator, I ask myself, how come guys cannot get the personalized information better than Google without stigma? That's how we started the HeHealth. So we did some study at the beginning. There's more than 10,000 anonymous questions being asked in Reddit about STIs in Reddit/STI alone. And we analyzed this information and realized 70% are wrong, like dead wrong. So we want to create something which is better than this. That's why we created HeHealth. HeHealth, we started as an image recognition for penis pathologies. When you see something, if you're not so sure, you can just take a picture, answer a few questions, you can figure it out. It has grown from there. So the beauty of it, I'll try to keep it small because I want to focus on the latter part of the lecture. So what it means is, anywhere in the world, as far as you have an internet-connected phone, you can use these services. WHO reports say doctors' clinical accuracy is about 50%. We, from 50% to the AI, we bring to 90%. And of course, it's affordable. From few $100 test, we bring it to $0.1 at a cost. So that's how we innovate. That's how we push the boundary. And we work with Harvard School of Public Health and USC, University of Southern California, to clearly document these findings. And we published it recently, like what Raina said. It took us 2 years to get the paper out. So innovation comes in 2 weeks or 2 months, and then it takes 2 years. By the time we publish, our model is completely dropped, and we're using a completely different model. So, and of course, for this particular one, we use 20,000 images. Our current model uses more than 100,000 images alone on STIs. And overall accuracy, I'm not going to go into details. We are hitting 94% current one. Actually, the newer one, we are using almost 99% in most of the diseases. I'll show you something cool later. And when this hits, Reina and me was looking at monkeypox or Mpox. Mpox was very unique because it was at that time concentrating among MSMs, men who have sex with men. And obviously, being a MSM, they have more problems than a usual regular person in the society. Most of them, they didn't want to openly acknowledge that they're MSM. And of course, if you're being diagnosed with a monkeypox or Mpox, you naturally come with the label then, oh, you may be gay. So some people told to me personally, I would rather die than getting diagnosed with Mpox. They've been hiding. I had a patient, he's been telling so many lies about it. He said, I had insect bites, I have this and that, where he was actually suffering from Mpox. But he was a married guy. He had a wife and a kid. Same time, he was having a boyfriend who had monkeypox. We are very sex positive when it comes to sexual health. We are not discriminating based on the sex, but providing the information they need. That's what they need. So because of the social circumstance, he don't want to tell. He begged to me and said, please do not report this. At that time, we have to report if there's an mpox for infectious disease protocols. And he was begging me not to. So I had to personally speak to the infectious disease physicians so that we don't have to actually document in the system itself. Of course, we took necessary steps, but we didn't put his name. So these are the actual things. And what it means is, this guy could have been spreading around because he don't know, he don't want to accept. These are the sensitive parts. The technology can be better. Again, I'll show it at the latter part of the lecture. Again, this one, me and Rainer, we published this in Sexual Health. We fully document. One of the things we want to share is that we used 1,000 monkeypox images to train this, and then 10,000 plus data points from CDC and WHO. And we managed to hit sensitivity of 90% and specificity of 87%. I'll touch a little bit of the beauty of the digital diagnostics. It's not like a physical diagnostic test where you have a positive or negative. We can fine-tune based on the person's need. If a country come and said, I want to capture most of the mpox possible one, but it's okay if the specificity is low. I can do a test and confirm it. We can fine-tune this model to easily hit a sensitivity of 95 to 99%. But of course, specificity will drop. If someone said, look, our healthcare system is good, but I want to be very specific. I don't want people to panic. We can easily increase the same model to 92% specificity alone. So that's the beauty of it. It's calibrated based on your needs or country or society's needs. So I think this is very different from a manual test. So it's same as manual anything versus digital anything, right? Digital things are very easy to manipulate. And same time when we did this, Stanford Medical Healthcare, there was another group led by Professor Alexandra in the Stanford. They did a similar project. They sadly only had access to 63 images where we had thousands. I'm not boasting about ourselves, but I want to touch also why we did well. We went to the community and said, look, we are building a digital tool to help to detect mpox. I sent brochures saying that dick pic for science. I'm not joking. So we get so much good response from the community itself. We, with the consent of the people, we use the images. And I'll give you one example. I had one guy sending me more than 100 high quality images where he documented from day 0 to day 14, 15, the whole spectrum of the mpox evaluation, the evolvement. So when he first saw it, actually it's quite funny, he knowingly got the mpox. His boyfriend had it, he said, yes, I want to have it so that I can get out of it faster. So on the day one itself, he was documenting it because he knew that he's going to get mpox. So, but what it means is we get one of the best documented image series of mpox from him. He happily came out and said, use this. I thought he will send me 4 or 5 images. He sent me 100 plus images, beautifully documented. That's the beauty of social innovation. We always, in the community itself, we explain what we do, we get the trust, and then we use it. And of course, I'm going to touch a little bit of other projects which is around. Again, I'm specifically looking at STI detections, diagnosis, and specifically looking at image recognition related or like visual symptoms. Then I'll come back to the rest of it, the overall future, how it looks like. And of course, this group is here, Dr. Sang is here. So they did something very interesting. They analyzed more than 1 million patient records and see the correlation and causation of STIs and HIV. What kind of behavioral patterns are related to HIV or STI. They found something very interesting also, but I want to specifically send something. If you look at it, sensitivity is usually quite good. Specificity is not so good. That means with the big data, it's a bit difficult still to really pinpoint and tell what's actually happening. So I'll combine these two and tell what's next. Okay, who knows these guys? Come on, raise hands. Seriously? Okay, I think I'm old. This is like 10 years ago. Seriously, okay, this is a movie called Matrix, and these are the AI agents. So what if we can combine some of the things I tell about the image recognition and combine some of the things which big data brings into the table, the correlations and causations, put everything together and ask someone to do the job for you. It's not future anymore. We have working models. I'll show you how it works. And these are undergoing testing right now. And we are actually releasing beta versions to public in Singapore, certain parts. So it's an exciting time we are living in. I'm sharing this part for the first time in a conference. We have not write down anything in a scientific way yet. But yeah, I'm happy to show some examples. Okay, this is, don't mind about the picture. So it's a scientific conference. I know the text is a bit small, but let me walk you through. So few things before the AI, the problem was it's all depend on how the user asks the questions. But we thought whatever the way user asks the question, AI will able to manage it. So this question, of course, it was me testing out. So I said I had unprotected sex and now I have a discharge. So AI understand the context. It gets the history from the user. This is very different. OpenAI have no capabilities of course, there are many AI companies have these capabilities, but this is how we apply. So it takes the history. Can you describe a little bit how is the discharge looks like? Do you experience any pain while you're passing urine? Is there any other symptoms? So and so forth. It can take, I haven't included everything here, but that's how we do. And of course, I answer, it's white color sometimes, and I use specifically layman's term so that we can see whether it's a normal person can get the help from this. And said, yes, it's burning, and then I noticed yesterday, and then I upload a picture. As a computer vision scientist, an AI scientist, one of the biggest things last time we had is, you always have to have large amount of data to train a very specific thing. When we built the HeHealth, we were managed to do things like syphilis, but never gonorrhea and chlamydia, because we don't have enough discharge pictures. But even if I give, it is not able to recognize or describe a discharge in a way. But look at this. It can say, images you provided showed in penile discharge and concerning for consistent with symptom of STI. Given the appearance and description, the history and the examination, you provided it most closely resembles gonorrhea, which is presence with a thick purulent discharge. And it tells you what is gonorrhea in a very short way, what are the symptoms, and what is the treatment. And not only that, it tells you very clearly what are you supposed to do, 1, 2, 3, 4. It tells you, please go see a doctor. Get it diagnosed properly, and treatment as simple as antibiotics. And not only that, it tells you the next steps. And said, do not have further sex. And also, please inform your partner. And all these things last time, a doctor, trained sexual health doctor, would take few, maybe most likely half an hour to do it. But look at the AI can manage all these things with the right training. It gets you what it is and diagnose most likely the case and guide you to the treatment and then tell you the extra social part, not having sex, do not spread, and please tell your partner. So this is the level which is not future, which is right now already have. I'll give you another example. So I ask AI, I have a wound in my penis, I'm scared. And then again, it takes the history very nicely. And I said, look, I have this, it's round, no pain, just started yesterday, and I have no other things like itchy or burning, and there was no accidents. It even asked all these things. And then I said, same thing, I upload a picture. This is openly available in Google Picture, not actual patient's one. So, and then you can see based on that, how it walk you through the details. It said based on the details you provided, and the ulcer shown in the image appears to be a chancre, which is commonly associated with the primary stage of syphilis. Syphilis is a STI, blah, blah, blah. And it tells you the diagnosis, the treatment, and again, the same thing, like what exactly you need to do. Like you need to go see a doctor, get it confirmed, tested, and then of course, same things like do not have further sex until you sort it out, and then calm approach. Because in the first one, I said, I'm scared. So that actually have the empathy also. Recently, there's a Harvard paper came in and said, when the first AI came in, we thought, okay, don't worry, we are more empathetic towards patients. So there was a recent study came and said, questions and answers without telling the patient, which is from actual doctor and actual AI. Most of the patients rated the AI answers as more empathetic. So we are losing the game on that also. So it tells you everything and say also, do not freak out, calm down, this is treatable, and everything else. And I'll show you something which, as far as we are the only one in the world have this capability, which is to follow up. So who have seen the movie called Her? Please, come on guys. Don't make me, I'm the only nerd here. Okay, please go watch. Beautiful story. Okay, this talks about the AI girlfriend, which this guy dates, and these capabilities were supposed to be many, many years in the future, but it's already there. Our system can already follow up given the context without a doctor's input at all. So when I chat this, next day morning, he come and ask me, hey, I wanted to follow up and see whether you have seen a doctor. I didn't reply. Look at it, it's 9 a.m. and it understands the time. So this is something we really did a lot of R&D, what you call temporal sense, for it to teach about the timing. And I didn't reply. After 6 hours later, it comes and insists, hey, just checking in. Did you manage to see a doctor and complete the STI testing as we discussed? He's so interested. Look, I'm not telling you, like, we agreed on this as we discussed. Did you check on it? And I finally said, okay, yeah, you're so sweet. Thanks for reminding me continuously. I'll go and see a doctor. So this is a current build system. Imagine the possibilities. So nothing hard-coded in this. That means there's nothing hard-coded. You have to manage 6 hours. The same system works for primary care, which you are already releasing. If you say headache, it knows the context of how long you need to follow up. If you say I had taken paracetamol, it knows that it takes about 1 hour. After 4 hours, the fever will come back and it'll come and check on you. That kind of thing. So I'll touch on a little bit of technology part, how we're doing it. So this is exactly what it is. We have something called multiple AI agents. If you think the AI is cool, next phase is AI agents. Again, techies here will know this, but AI agents are the one which can get the work done for you. So AI is cool, you ask questions, it gives you answer, but still you have to do the work. AI agents are the ones which can do the work for you. So we have trained multiple AI agents in the same system. We have given specific objectives or work descriptions. One is a diagnostic agent. When someone says, I have pain, it immediately thinks, okay, what can it be? So it asks multiple questions to understand more so that it able to come to a diagnosis. And second one is called treatment agents, for example. It understands all the CDC guidelines which we based on, and then we come up with, once the diagnostic agent gives you a possible condition, it comes and says, okay, these are the things you need to do. And of course, there's someone called orchestrator agent, which we put the name. He's the guy who coordinates everything. You know, one guy tells this, another guy tells this. And then lastly, the follow-up agents. So we have multiple follow-up agents picking up things. If he said like, okay, I had this, one guy will come and ask, is it actually better? Did you check? So and so forth. So this is the future. And these systems can be implemented in many other things. As I said, we are implementing across the primary care, and not only in the sexual health, but again for developing countries when the resources are not good, this is massive difference. And we already start testing AI versus doctors, and guess who's losing in? Doctors are losing big time. I'm quite shocked because I'm a practicing physician still, but this is the future. So AI is able to manage most of it. Of course, next step for us to put this into the society and start gathering data and publish it so that the actual numbers will come out so that we can actually move to the next step. Okay, so again, as I said, we already have these things built into certain levels in our website. Otis is our own bot which helps you to guide through these things. And of course, we are releasing it to the public in a very controlled manner so that things don't go haywire. These are most of the R&D since it's the future I'm sharing with you guys. And what's next? So myself, through HeHealth, we've been talking to WHO for almost 1 year plus, adopting technologies. It's the same thing. It takes time. So when we started, we had a very basic technology, but now we have more advanced technology. But finally, we managed to sign some papers and move the technology adoption to the next phase. We are looking into deploy these things into Africa and India as a first step in a controlled manner. And UNAID is in discussion with that to fund some of these activities. So that's basically it I have, and I would love to take questions, especially tech questions. I'm more than happy to take. And if you need to have anything ask me off the stage, please scan the QR code. And you can find me in LinkedIn. I continuously share things of how we do it and so on and so forth. Again, now the time is changing. I honestly don't think the traditional research systems are able to hold the speed of change. So I continuously, openly explain these things in my LinkedIn so that people can see it, they can question, and so on and so forth. And lastly, I'm looking forward to the lecture about stigma and access tomorrow, which I can share some of the personal experience I had to face as an innovator and how the stigma is pushed on me in the US. And if you Google my name, you can clearly see a lot of things. So these I'm going to share tomorrow. If anybody interested, come tomorrow. That's all.